Okay, welcome everybody. I see some people still coming into the room, which is great. Welcome, welcome. We're so glad to have you here tonight. Thanks for joining us for this event. We're going to give people a couple of minutes to join. So while we wait for folks to trickle in, please just take a moment to introduce yourselves in the chat if you'd like. We'll be starting shortly. Get yourself a beverage, whatever's gonna make the next hour feel really comfortable for you, and we'll get started in just a minute or two. Can see people still trickling in, so we'll just give it another minute here before we get started. Go ahead and use the chat and tell us to say hello. Where are you zooming in from today? Where are you watching us from today? And maybe what organization you're joining us from. All right. All right, so as we wait for more people to come on in, let's see people in the chat. We see a little bit more folks showing up. We'll get started. We've got a really good evening with you all today. Thanks for coming. Thanks for joining us. My name is Melody Martinez. I am the Executive Director at the Multicultural Veterinary Medical Association, or MCVMA. And for those of you who are new to MCVMA, our mission is to lead veterinary medicine toward the racial and ethnic diversity, equity, and inclusivity that our profession needs to serve a multicultural society. And we envision an equitable and inclusive veterinary profession where people of underrepresented races and ethnicities are valued and supported in their careers, resulting in all communities receiving the benefits of veterinary medicine. You can learn more about us and what we do at mcvma.org, and we'll put that link in the chat. We're also really grateful to be able to bring you not only this series of webinars that we're doing called Beyond the Page, but open access to the Elsevier publications on DEI that we'll be highlighting throughout the webinar series, all of which has been made possible by a grant from Maddie's Fund. And we'll put the link for Maddie's Fund in the chat as well, so you all can learn more about Maddie's Fund. And I see people are still checking in and calling in from different places. Wonderful. Great. Okay. So we have a few reminders before we start tonight. This session is being recorded and it's going to be available for viewing later on our YouTube channel. We'll send the link out in a few days after this event. We also have a few items of housekeeping. Please use the Q&A feature in your menu bar and not the chat to ask questions so that we can track questions and so other attendees can upvote the questions they want answered. We have time for a Q&A at the end, but may not be able to answer every question this evening. You can also turn on live captions and translated captions in this webinar. Just go to the captions feature in your Zoom menu bar, which should be below this video. If you're on a computer or tablet, and click on Show Captions. Click on the little caret in the top right corner of that button to choose your preferred language for translation. And if you need support, please use the chat to request help from our tech support. All right, we're ready to get started. Let's see here. All right. Our guest tonight is Dr. Michael Blackwell. Dr. Blackwell serves as the director of the program for pet health equity at the University of Tennessee, where he leads national efforts to improve access to veterinary care, especially for families with limited means. His work is grounded in a vision of health equity that recognizes pets as essential members of the family. A retired assistant surgeon general and rear admiral in the U.S. Public Health Service, Dr. Blackwell served for 23 years in active duty, holding key national leadership roles, including Chief of Staff at the Office of the U.S. Surgeon General, Deputy Director, Center for Veterinary Medicine at the U.S. Food and Drug Administration, and Chief Veterinary Officer at the U.S. Public Health Service. He also served as Dean of the College of Veterinary Medicine at the University of Tennessee, advancing One Health initiatives and interprofessional collaboration. Dr. Blackwell has received numerous honors, including the U.S. Public Health Service Distinguished Service Medal, Meritorious Service Medal, and two Surgeon General's Exemplary Service Medals. He is the 2020 Avanzino Leadership Award recipient, the 2021 Senator John Melcher DVM Leadership in Public Policy Award honoree, and the 2025 recipient of the American Veterinary Medical Association's Frederick D. Patterson Lifetime Achievement Award. Welcome, Dr. Blackwell. It's an honor to have you with us this evening.
Thank you so much, Melody. I'm happy to be here.
Well, you have obviously a very decorated individual with lots to offer, lots that you have been offering the veterinary profession. And one of those latest things was an article or a chapter in the Elsevier Veterinary Clinics Small Animal Practice Diversity, Equity, and Inclusion in Veterinary Medicine series. Let's start by giving the audience here tonight a brief overview of that chapter and the key points that you discuss. Your chapter's titled Bridging Gaps in Veterinary Care, Equity, Access, and Innovation. What's it all about?
Well, thank you for giving me the opportunity to give sort of the overview. There's a simple takeaway message if one were to read the article, and that is essentially that we still have way too many underserved families, and that not serving these families harms all, because not only is the pet of the family not receiving needed care, but the family is, of course, impacted because a loved one, in this case, their pet, is not getting that care and maybe suffering. But veterinary care teams also are impacted by these conditions because we want to help. And I think most of us hate to think that money gets in the way of helping or basically anything else. So the chapter is really a call to action to really press ourselves harder about innovative approaches to delivering care services to these underserved families across the country. I do want to, in fairness to the veterinary medicine profession, say this. We didn't create this societal problem, um, and we can't solve it by ourselves. And so, what may not be as evident in that chapter is the need to build collaborations beyond veterinary medicine, reaching out to social service, public health, and even human health care, where resources may exist to help, especially from the financial side.
It's great to hear that, and it's interesting to hear that. I'm excited to chat more about those pieces around the interprofessional collaboration, right? That
Mhm.
we can't we didn't create the problem. We can't solve it on our own, and it's going to take a lot of different
Yeah.
hands getting in there and working on it. To give folks who might be in the audience tonight who are less familiar with kind of the term access to care or the issues surrounding access to care, let's chat a little bit about what makes veterinary care inaccessible. I imagine that most of the people tonight know or assume that cost is the most significant barrier for people with limited or no income. What are some of the other barriers to accessing care that folks might miss, and who specifically is impacted by those?
Yes, I think most of us would have assumed if we just stepped onto this planet for the first time, but that money is, or lack of money, is in fact the primary barrier overwhelmingly. We did just release a report this past August, and money still is being reported as the number one barrier. But since the 2018 report, we also found now a higher degree of reporting that appointments are not available or there are long wait times.
Mm.
And then also more logistical challenges. What are those? Not being able to get transportation or make other arrangements in order to be able to make that trip to the veterinarian. So access to care is really a complex problem. And of course, therefore, there is no one solution. We have a diverse society with diverse challenges and diverse barriers, and that calls for diverse approaches to providing services.
Yeah, it sounds like it's, when once money is a factor, if money is not the main factor, there are so many other things that can
Yeah,
impact, depending on kind of your phase in life, your circumstances. I'm assuming language is often a barrier, being able to
yeah.
access services
Language
in the
definitely
language,
is one.
yeah, that
And
you.
and let's not forget there are still people who, and these are more the psychological barriers, uh, due to embarrassment or fear
Mm,
about how they might be judged because they showed up late or they
right.
have this big problem and they're not able to take care of the problem by themselves. And so, yes, the barriers are many. Um, all most of them being quite secondary to money. Money tends to solve a lot of problems if you have it.
Create a lot and solve a lot, depending
That
on who
that
you
is true,
ask.
yes.
Not everyone here tonight may be familiar with the concept that you brought up in your chapter of health equity. How do you define health equity in the context of multi-species families? And what do the 5 A's of access to care have to do with it?
Yes, well, let's first remind ourselves of, well, what is health? And generally, the definition is health is more than the absence of disease, but in fact, the presence of well-being, and both physically, mentally, socially, and so forth. Equity is often contrasts with equality, um, and especially when it comes to providing services. So if we were to provide services equally to everyone, then there's one fee for given service, and regardless of the person, that's it. And the way they get in for services and the way they get those services, all treated the same. And there's probably something to be said about equality. But our families are not starting from the same position. And so whether it's ability to pay for services or ability to do at-home treatments or ability to get to the services, and we can keep going. So, an equitable system of delivering care actually means that adjustments are made in how those services are delivered in order to ensure they get delivered. The ultimate goal, though, is health equity, and it basically says that everyone deserves an opportunity to enjoy health and well-being, an equitable chance. They can't pay for it the same way, but if we live in a country and in a system that believes that all deserve health and well-being, and all in this case would be all family members. So we're talking about the humans and the non-human family members, the pets. Then our systems should reflect that the diversity that makes up our society in order to ensure at the end of the day, everybody is getting access to essential care.
Wonderful. So really the idea here is that it's the fundamental, the right to health, essentially. Um,
Yes, yes. And I think that's an important point. Do we have a right to expect that we should have an equitable chance at health and well-being? And I think most people would say yes, that should be viewed as a right to have an equitable chance.
This is such an interesting conversation because, when we're talking about people, there's a lot of people who agree, yes, everyone should have access to a chance to equal health, or the equitable health, right? Everyone should have a chance to get their needs met. And then when you switch the conversation to pets, you get met with a lot of different judgments around
Yes.
should have a pet, right? If you don't,
Yes.
you hear it a lot in our profession, right? If you don't have the money, you shouldn't have one, right? So the idea here is that a pet is a luxury, right? Or a privilege, not a right, and not something that everyone should have or access to. And I'm gonna take us in a little bit of a sideways direction here, around that. How do you confront that sort of judgment, or that sort of
Sure.
kind of way of thinking, when you're trying to also when you're advocating for health equity?
Yes. Well, I would say to my colleagues in training, uh, including those who are just getting started, the veterinarian's oath is pretty straightforward in the very first sentence that we promise to use our knowledge and skills for the benefit of society. And then that oath goes on to talk about how we do it in addressing um, the needs of animals. You can read it 1,000 times, and nowhere in there, thank God, am I being asked or took an oath to say, and I'm also supposed to determine who makes up a family, or who someone might choose to have as family. My job is to try to provide services to this society to keep it healthy. So there is logic when one may think, well, if you can't afford a veterinarian, you should have a pet. Excuse me. I deal with allergies. You'll have to work with me here. That's a very logical train of thought. But there are two major problems with it. One, I've just touched upon that I don't want to sign up for the role of telling Melody who Melody should have as family. And I certainly don't think the government should sign up for that responsibility, that we should have the right to choose those whom we love.
Mhm.
Um, so that's one problem with the logic. The other one, though, is more science-based, and that is pets afford mental and physical health benefits to humans. That we know living with pets actually improves our overall health and well-being. And in fact, for our seniors who would be facing isolation and loneliness were it not for their pet, we know that outlook on their the outlook on their future as far as morbidity and mortality is much worse. So there are costs in our society when people are not able to have access to anything that improves their health and well-being. So the problem is not the relationship. It never was the relationship. The problem is we have not built the systems to support the relationships that make up our society. We should celebrate those relationships. And of course, I'm talking about healthy relationships. We should celebrate and honor those relationships and seek to keep them healthy, at least as far as those of us who took a medical oath. Um, and again, thankfully, not have to be the judge about who's supposed to love who. And um, yeah,
Right.
let's just stay away from that.
Yeah, yeah, definitely. I feel like I hear you, and it's we just stop the webinar now. I mean, that's the end of it right there. No, just kidding, folks. It's, I agree. I love this idea of, it's we're not the arbiters. The relationship was never the issue. It's the system in which that relationship exists,
Yes,
and what it does and does not afford people, how it does or does not take care of people. And I love the connection, that we all know, I think, in this webinar, that animals are part of our families, and afford us a lot of great benefits, in terms of mental health and physical health, all of the great things that pets bring to our lives. And why wouldn't we want that for everyone?
yes,
Um,
yes. We
let's
do have a number of analogies. I know you need to move on, but I can speak as a minority in the United States. My color should never have been the problem.
mhm.
You
Yep.
know, if I have trouble advancing in this society, one looks carefully, well, is it because of my color or is it because there are systems that may impede my ability to excel in this society?
Yeah.
There are a number of analogies to this.
Yeah. And I think one of those, let's take one of that's a really good segue because I think we can talk about the how this relates to the clinic, right? So your chapter highlighted two concepts that I think many vets are becoming familiar with, but that haven't been implemented as standard practice, the
Right.
spectrum of care and incremental care.
Right.
What are they and how do they differ or support one another? In what context do you see these two kind of concepts
Yes.
kind of coming to life in a clinic?
Well, both are concepts and methodologies, philosophies, and they are not new. So let's start with spectrum of care. Succinctly stated, when you look at all of medical science, all of the options available in medicine, options for the healthy, well person or individual or patient that wants to remain healthy and access services that maintain their health, all the way up to the critically ill individual. There are options across a broad spectrum that are available according to the health status of the patient needing the care. That's the spectrum of care as we like to see it. When we practice veterinary medicine, when we're engaged in patient care, we are choosing, based on our scientific training, professional knowledge, we're choosing which options in the whole spectrum are appropriate for the situation. So if I've got a healthy patient, I'm probably not trying to figure out how we're going to do some kind of an invasive procedure. It's not appropriate for that patient. So the spectrum of options fit the needs of the patient. We pick and choose using scientific knowledge what is appropriate for this situation, maintaining health, treating a sickness or injury, or something that's very critical and needing more advanced care. That's spectrum of care. Now, within that spectrum for a given patient, the question is, what do we do when someone can't afford everything that I want to do as an attending doctor? And let's just stay in the wellness and preventive care category. Client wants to take care of their family member, this dog, in the community in which we live. There are these five things that are very, very important to be done to maintain the health of a dog in that community. That's a combination of vaccines, parasite control meds, and you can add to that list. But that client on that day can only pay for part of that list. Let's say three of those items. Well, we don't just close our eyes and throw a dart at the board and say, well, which of these three we're going to do? We're going to choose out of our professional judgment which three are the most important that day with the hope of doing the other two items on a subsequent visit. That's an incremental approach to getting to the 100% of what needs to be done. Now, these decisions can be simple or they can be quite challenging. And again, this is not a new concept. This is what goes on in veterinary medicine. What Where the deficit is, we have failed to standardize the decision-making process. We
Mm.
think, I think our schools need to be teaching methodologies about incremental care. And it's all based on the fact that, hey, not everybody is privileged. You've got this wonderful list as a good doctor about everything that can happen. What do you do for that person then that can't afford all of that, but they can afford some of it? Now, how do we logically work through that list until we get to everything that needs to be done over time? That's incremental patient management.
So interesting. I was recently at the doctor myself, and this was what was put before me is here are the different options that we could go. Here are the different outcomes. This is what this affords you, that affords you. And I was sitting there thinking to myself, this is just so normal. I come to expect this sort of interaction with a healthcare professional in my own health, or as a caregiver for my parent. And I think to myself, like, I don't recall experiencing this sort of thing, when I was coming up in the veterinary profession, is sort of like, here are the different options. You can kind of, here's a menu, here you can pick and choose, and we'll kind of go in this direction if this is all that we can do today. Or let's hope that it's this kind of ear infection. We'll start with this medication, and if not, then we'll go from there, right? So it's just interesting that this concept, like you said, it's nothing new,
Yeah.
uh, but that we haven't in the veterinary curriculum haven't kind of moved away from teaching that gold standard and teaching a more relational approach to care for pets.
Yeah. And something we've observed is if you're talking to one of our really experienced practitioners, someone who's been at it for many years, they've been practicing medicine for many years, you are more inclined to have a doctor who is more comfortable with these options and what you put on the table and what you don't put on the table. What we have found, and this is anecdotally because we didn't scientifically study this yet, but younger veterinarians, less experienced, are saying more apt to say, no, I've got to do all of these things or I can't help you at all. Or maybe certain business models, practices were set up to say, we got to do it all or we can't do anything. And that's pretty black and white in a very colored world. It's
Yeah, I remember recently experiencing something similar. I volunteer at a community health clinic for pets, and we get a lot of volunteers who come in, veterinarians who come in. There's no veterinarian on staff, so every professional who provides medical care there is a veterinarian or certified veterinary technician. Or an assistant, right? And the newer veterinarians who aren't used to the clinic not having all of the gadgets, all of the fancy gadgets, they're like, oh, what do I do if I've got to diagnose this and this? And I was like, you've got to rely on the history. Yeah, someone that's been there for about 5 years. I'm like, you've really got to rely on your history taking skills, right?
yeah,
And kind of use your best judgment, and try to kind of practice with the client, trying to figure out what's the best approach for what most people who come through can't afford anything. What's the best approach that's going to help get us at least a little bit closer to a healthy outcome. And you can tell the kind of volunteers who come in through no fault of their own, right, have been kind of conditioned by some of the places where they work to need to do all of the diagnostics, despite kind of knowing what knowing what might be wrong with the patient, right?
yeah,
But still feeling kind of this urge to be like, I've got to run this test, I've got to do this other test. Even though, I end up asking a lot of the vets I work with, I say, will running that test change the outcome of what you think you're going to uh, like
that's
ultimately
the
prescribe?
question right there.
And they'll say, no, we're still going to send him home with X, Y, and Z. And I go,
Yeah.
well, in that case, you don't really need the diagnostics, do you? You know, it's a hard thing to break out of. And like you said, I
And
noticed that it's a lot with the younger vets, or the
yeah, and
newer.
Melanie, let's in fairness to this discussion, there are ethical concerns and there are business concerns.
Yeah.
The ethical concerns that are very much to be admired is, am I being a good doctor if I don't do everything? Is that quality care? Um, and these are the things that there's no one answer to that. That's very patient specific and veterinary care team specific. But we don't want to miss the one obvious, and that is some level of care, good care, quality care is better than no care at all. Or to put it another way, is it better to just take the life of the individual because the individual was unfortunate enough to afford the gold standard privileged model? We definitely don't want to live in that world, I don't think. But the other ethical concern is, or which is more of a business concern, is I appreciate there's a bottom line that businesses have to meet. And every case that comes through is part of that equation. And veterinarians are notoriously known for shaving fees and trying to do all sorts of things to try to meet that client. So I'm definitely not being harsh or very critical about the profession. I'm just simply saying that is not going to go away. And as good of a job as we've been doing, we're going to have to continue to step it up and standardize these decisions so that we gain efficiencies in the process.
Yeah. Yeah. So so thanks for breaking down kind of spectrum of care and incremental care and how those approaches can help shift how we engage with clients around the care of their pets. I know that you had mentioned it earlier, but the new Access to Veterinary Care report from the Access to Veterinary Care Coalition was recently published in August. And that report highlighted some changes in how families are experiencing access to veterinary care since the beginning of the COVID-19 pandemic. Aside from spectrum of care and incremental care approaches, what do the findings of that report suggest can increase access to care in communities nationwide?
Yes. Well, I certainly invite everyone to take a look at the report if you haven't had a chance. Essentially, what we wanted to do is replicate the 2018 study. And therefore, most of the questions asked of these families were the same questions we asked in 2017 during data collection. We added a couple of new ones um, to try to better understand workforce issues, if you would, and so forth. So what we basically found is, in comparing the two, was that the average number of pets has dropped a little bit. We measured 2.2 per household. It's two now. And that now almost half of the households actually have one pet in them. And an increased number of households with only one pet compared to 5 years ago. Um, we found, and I alluded to this earlier, that um, access to appointments, uh, whether it's a convenience matter or they're too far out in the future or any number of reasons, that is an issue. We did not measure that in 2017, so we can't compare movement in that sense. But I think most of us have probably seen one thing or another about workforce issues and concerns that people are having to wait long times to get in. Um, we found what we expected to find as far as the younger pet families. Household income, of course, is lower, and but making more likely to make the decision around pet health insurance and microchipping and those sorts of things. Now we can ask ourselves, what does that mean for the future? Well, it's a generation of individuals who do care. And
Yeah.
so, do we want to say, no, you shouldn't have a pet at all, especially given the health benefits? I don't want to keep going on that, but let me just encourage everyone, and hopefully I can answer any other questions specifically around it. There has been movement since 2018, and it's in the direction of getting worse.
Oh, okay. That,
Yeah,
that's
as
what
far
nobody wants to hear that.
more struggles. Well, COVID-19 and then inflation and just a number of things have impacted people's ability to pay for essential services.
I'm curious, I know this isn't one of the questions that we had talked about before, but I'm curious, have you noticed, since you're kind of really enmeshed in that world of access to care, has there been more movement in terms of more One Health clinics popping up, more municipal shelters offering more discounted services or free services, or more of those sort of community clinic styles, or any more approaches to like meeting the needs, the increased
Yeah, I
need.
appreciate that question, Melody, because um, we didn't measure response since
Hmm.
2018 because we were just replicating that study. But I can tell you from lived experience, after the Access to Veterinary Care report issued in 2018, the conversation started and the volume just continued to increase. And then we started to see activities all across the country, a lot of innovative thinking. I mean, I have a lot of optimism about the future because, yeah, people get it, people care about this, and we're seeing new ideas come to the table. Um, so, yes, the short answer is, even though we didn't measure that in this last study, there has been a real palpable increase in interest and activities to help address this. My hope is that all of this activity continues to morph into more of a coordinated effort. And one other thing I'll say, which gets to our strategic work here at the University of Tennessee, um, how do we get to coordinated work? Well, we come to appreciate that if you piled up all the money in animal welfare and veterinary medicine, it's a drop in the bucket to pay for the veterinary care needs of these underserved families. But there is a bigger resource pot out there. There are multiples. And the idea is how do we align with the interests of those pots so that the pets that we want to serve are getting veterinary care paid for? And I
Mhm.
do believe there's a way forward here. And I'll give you just an example. I do believe in the future, both government programs that pay for human health care and health insurance companies that pay for human health care are going to find it necessary to invest in keeping those pets healthy and in those homes because that's going to lower their costs with the humans. Unfortunately, we don't have all the data. We, the bigger we, don't have all the data that is needed to make that case crystal clear. But people are starting to get those messages and see, and I know that because of conversations we were able to get into. So it's not so much finding new money, it's saying, whoa, let's not spend so much on a sick human when we could have kept that human healthier for a whole lot less money. Now, guys, in order to do this, okay, and I'm going to step on toes now because not being mean, not so relaxed.
I audibly gasped. I have so many questions.
No, bless our hearts. Our world is so wonderfully focused on animals. We signed up for the animals, you know. We we may not even like humans in some cases, but we are so focused on the animals or being pet centric. And one important strategic transition we're going to need to make as animal welfare and veterinary medicine is to make this family centric. Bring the humans into the picture because when you make it a human issue as well, you're going to reach the pets because you help address those humans. So if we look out and we see some humans that the system ignores for whatever reason, and they have inadequate access to health care, you better believe it. It's a pack impacting those animals that we in the homes of those humans that we would love to see have a better life. So let's start to look at the family holistically, but in particular, pet families. I'm not getting into livestock. I know there's some who might have a question about that, and I'll be happy to go into that. But most of our families are not living an agricultural life. They may even eat animal protein. They live with non-humans that are dogs and cats primarily, and a number of other species as their family unit. Let's start to make our conversation about that family unit. We'll capture the pets in the process, but the money is out there to help the humans.
Yeah.
You understand? You understand what we're doing here, right?
Yeah, this is great. I recently had this conversation with a nonprofit professional who was talking about, the money in animal welfare. Like, there's only so much money in animal welfare. And we were having this exact discussion. It's like the pets are part of the family. How do we go after those grants that are for pet family health, right?
Yeah.
Or that they're thinking about humans, right? Those grantors or those funders are thinking about humans, but we've got to be able to tell the story about how pets are family and what they do for the family. And then all of a sudden it starts opening up these ideas, these doors potentially to a more robust, more well-funded
Yeah.
care model for people who are underserved, who have pets.
And
So
let's hasten to say it's not just Melanie and Michael who are calling them family members. The
yeah.
Pew Research Center in their latest survey found that 97% of these families with pets consider them family members, and 51% said the pet was just as important as any human. So that's not us saying that. That's what society is saying about themselves.
Yeah.
Let's work with that. Let's leverage that.
Yeah. I audibly gasped earlier because you said something and I was like, "Oh, how do I address that?" One of the questions that I have, is in your chapter, you talked about this vision of ensuring that no pet suffers due to financial constraints. And I think that's a really bold, like I remember reading that and just being like, yes, I agree. And oh wow, that is really bold. How do we make that real?
How do you do it?
Some people might say it's impossible, right? With the current for-profit model that makes up the majority of the profession. What would you say, or do you have anything more that you would say to people who look at kind of our own broken human healthcare system, right? This idea that like, oh, those insurance companies, those government entities, they're eventually going to want to keep us healthy. And people who say now like, no, they want us sick, right? They want to keep it. That's how they're making their money, right? What do you say to people who look at kind of our own human healthcare system and think it's impossible to achieve what you believe is possible, not just for pets, but for families,
Yeah,
and who bears the responsibility of financing that care?
absolutely. And I want to put on my public health hat a little bit by saying that historically, public health, or that is preventing problems and maintaining health, has not gotten the attention that public health deserves because capitalism actually doesn't grow a whole lot when you got a healthy population. Or to put it another way, the sicker you are, and certainly if you need a medication that you take every day for the rest of your life, well, that's a machine that is hard for people to walk away from. But here's the pressure that's on the nation, okay? And we look at the generational shift. I was just saying something earlier about young millennials and certainly Gen Zs not going to make the income of their parents' generation. And so these systems built on capitalism, pricing that reflects that, was based on a previous society. It's not sustainable as the average household income not only stays static, but starts to drop on average across the country. So I think the nation is going to have to revisit all of the systems where essential care is needed. And there's one other wild card, and it's not so wild though. Our public policies still, not 100%, there's still some public policies in this country that are a result of the people who go to the polls and say, this is what we want.
Mhm.
And so as we look at the voting blocks, in fact, if we look at young millennials and Gen Zs, we're talking about the majority of voters in this country. Now, not all vote, but should these generations say, hey, this is our lifestyle, living with pets, and these systems don't meet our needs. In fact, our loved ones suffer and die because, well, I think there's some power to fix that, but we've got to be intentional about wanting to fix it. And with these realignments, we can rebalance our system from a sick care system to a healthcare system, getting to
Ooh,
your point about how human healthcare works. And they need to learn a few things from veterinary medicine, by the way, because veterinary medicine's roots are in agriculture, and that meant preventing diseases so
right.
animals could be consumed. And we grew up to become a medical profession, but we still have our preventive medicine genes. And if we start to infuse that logic into human healthcare, and they already have it, but they need more of it, we can influence that system as much as we need their resources to
Yeah.
help us in our system. I know
Yeah.
that sounds like crazy talk maybe to some, but I do see as clearly as I'm watching you, Melody, on this monitor that that's the future that can be had. And it's going to come out of pressure to make changes, whether it's climate or a number of other issues that we're confronted with. The younger generation, those of you listening, you got a job in front of you and you have the capability. You're intelligent, more intelligent than the previous generations, and you have the tools. So start making plans for how you're going to improve your future on this front.
This is a really great segue. I want to make sure that we get to our Q&A. I don't see any questions yet in the chat, but if folks have questions for Dr. Blackwell, please make sure that you put them in the Q&A. One of our last questions here is, in your chapter, you wrote about veterinary professionals needing to have the moral courage and integrity to do what is right. And we just spent some time talking about that. Help us go beyond the page. The series is called Beyond the Page for a reason. Help us go beyond the page to understand what that means. What is one thing that veterinary professionals can do differently or do immediately to take the ideas you wrote about in your chapter off the page and turn them into meaningful action in their own communities?
Get mad? Now let me explain. Okay, I've been in the profession all of my life. My dad was a practicing veterinarian during my upbringing, and I'm an old dog. And I can tell you, we have historically been a conservative and largely reactive profession. We do our work quietly and we do it with great honor and care, but we never is a hard word. You would be hard pressed to find evidence where veterinary medicine weighed in on social issues.
Mhm.
And why would we want to do that? We don't want to hurt our practices and so forth. I get that. But if your patient that you are supposed to be advocating for is being harmed by the system, well, ask yourself, what does my advocacy for animals extend beyond the walls of my clinic? Or put it another way, as being among some of the most intelligent people in our society, do you think you were given the blessings of that intelligence, but not benefit society other than you took care of the dog that came in yesterday? I'm saying we've got a bigger role to play, and our advocacy is what's important. We don't go out and fix it, but when we add our voices through organized efforts, through our associations or whatever, but being very strategic, add our voices to these issues, people listen to veterinarians still, and we can be a force for change.
Oh, thank you. Is there anything else we didn't talk about tonight that you'd like to make sure to mention, or are there any other projects you're working on that we should know about? I'm not sure if if you were able to hear me. Is there anything else we didn't talk about tonight that you'd like to
Oh,
make?
you're asking me. I'm
Yes.
sorry.
Yes, you,
Oh,
the
you were
speaker.
talking to the group. No, I appreciate the questions, and I certainly hope in our remaining time, if anyone still has a question they'd like to pose or challenge me, don't just, you don't have to take anything I said as truth. We learn by having conversations and challenging one another's precepts, ideas, assumptions. Help me grow. Push back on anything that you believe is off base.
I'm not seeing any questions in the chat yet, but we do have time for Q&A. So if anyone in the audience has a question for Dr. Blackwell tonight, please make sure to put it in the Q&A. And in the interest of keeping the conversation going as we wait for folks to put their questions in, I'll ask a few more questions. We did get some questions submitted during registration. And one of those questions was, what policies at the national and local level do you feel are most important for increasing access to veterinary care?
Those policies need to facilitate the transition of our laws to be in sync with our society. What do I mean? Under the laws of the United States, a cat is still personal living property. Like my living plants back here, personal living property under the law.
Mhm.
But society, as we were just talking about earlier, doesn't see it that way because we know that if someone abuses their dog um, and it's found out about, they could be punished for that, including imprisoned. So society does not treat our pets as though they're just a plant that lives in someone's home. So through time, our public policies need to shift in sync with the lived experiences of our families, and the laws will get changed accordingly. That's what I see happening on a national scale. It's going to take some time. But what is going to drive those policies is public health threats. So,
Mm.
veterinary medicine's one of our key jobs is to prevent and control zoonotic diseases, those infections that can be passed on to humans from a species of animal, or parasitic diseases, if you would. As more and more pets in our communities do not have access to veterinary care, it's increasing public health threats in that community and ultimately the whole nation. So that's going to become a driver through time. If this avian influenza thing continues to go the way it is, that is going to bring another point to the fact that it's not only humans that are acquiring these viruses, like COVID-19, but avian influenza or the many other viral and bacterial fungal diseases. And that's a cost to the country. We're spending all this money to take care of something that could have been prevented if we ensured that all of the family members had access to health care. It's those kind of scientific public health drivers that will lead to that national change in laws and public policies, regulations out of necessity.
Right. Great, thank
And
you.
you all notice I didn't say compassion. Yeah.
Yeah.
It's not the government's job to provide you compassion. It's just as, I mean, we need to make science-based arguments for why um, resources should be made more available to veterinary medicine to ensure our families are healthy.
Yeah, and and by extension, our communities and our and the country, right? Yeah,
Yeah.
that makes a lot of sense. Oh, I see a question in the Q&A here. Let's see. Uh, it says, is there anyone out there, individual or company, that is really advancing access to care through community health centers or other nonprofits that you think are doing it right or are good examples to follow?
Um, thank you for the question. I will not start trying to drop names. I will simply say the problem is big and complex. And just about anything anybody is doing with the intent of improving the situation is helpful. There is never going to be a best or perfect. It may be best or perfect in a given community, but communities are so diverse and populations are so diverse, even within larger communities. So, yeah, there's no one size fits all, no one way to go about it. We need every option on the table.
Would you
That's a
say that
strong argument for diversity, by the way, diverse options, diverse approaches.
have those approaches, I'm curious, have those approaches kind of increase or like the need for access to care, has that been a driving force in your opinion, to the preponderance of telemedicine and telehealth options that are kind of out there now?
Unfortunately, in veterinary medicine, I don't think it's at the level that we need to get to. It's part of the reason for telemedicine, telehealth services, quite frankly, is not driven by veterinary medicine.
Mm.
It's driven by human health care. And COVID-19 taught this country, oh, not only is this convenient, but it is in fact an effective way to get certain services. Now, some of my colleagues might say, well, that dog cannot talk. That cat can't explain what's going on. And you're right. And but that doesn't mean zero options are available to address the family and help them. Because I want you to talk to this mom with this 6-month-old on her hip. And that 6-month-old hasn't explained a thing, but she's gotten excellent virtual services. I guess what I'm saying is let's don't make it so that a person who doesn't get paid to take off from work, they have to take off from work and they must come in, and that could have been handled through a virtual visit. I mean, we can price the services away from so many simply because we are not making them equitable. And
Right.
equity in this case would be if it's a suture check or something else, why am I going to force you to lose money? And some have to pay for transportation to get there, and that's rent money or food money for the kids. This is the impact of forcing into a physical space for every single thing that must happen. We're getting there, but I think we need to step up our embracement of technology. Let's put
Yeah.
it that way, and not lose the doctor in the process, to be clear. Okay.
Yeah. I've got another question here in the Q&A. It says, are there resources for newer veterinarians to better practice incremental healthcare?
No. Lots of conversations. We have been having many of those with a lot of the veterinary colleges. Um, that's the deficit. And if you happen to be a person who um, can start to develop CE courses around that, I think people would sit in on those courses. If you know or you're connected with veterinary medical education or other organized approaches, please encourage faculty and those with experience to start developing curricula to train veterinary students, but also CE for our practicing veterinarians because there is a deficit there, lack of standardization, and just achieving that will go a long ways.
Oh, thank you. Got another question that just came in. It says, how do we mitigate the gap between the reality that pets are members of our families, as Dr. Blackwell addressed, and orgs such as AVMA and others being fearful of that translating into policies that make it easier to sue veterinary professionals?
Yeah. Well, I first want to acknowledge that there are entities with concerns, and many of these concerns are legitimate. I mean, as a practicing veterinarian, I wouldn't want my liability costs to go up uh, or be exposed to higher awards in cases. That's going to be there. The problem we have, though, is how can I look my client in the face and, with all sweet words, talk about how much I value their loved one and that human animal bond, but then it'll slip out. At the same time, I'm going to denigrate, demean, lower the value of that individual in the family. We can't be hypocritical like that. I think that comes back to bite us. So we need to find our voice where we are honoring the bond and stick with that voice. Or if we want to take the legal lens and say, nope, we're going to make sure no liability, well, let those people have their voice too. And society will ultimately determine what they think about the two voices.
Yeah, it's interesting. I'm sure some folks tend to, there's some belief out there that incremental care could compromise medical standards or what pets are being
Mhm.
offered, putting veterinarians at risk. So it sounds like you're saying the veterinarians need to kind of navigate between what's good enough, what's the best possible treatment, and try to
Yeah.
support that individual, right? That individual pet, that
But
pet.
one other important thing, Melanie, we need to say, and the courts will back me on this. Your medical record.
Mm,
If you're having a conversation with your client and you're explaining these options, and it's understood that the client is limited and can only pay for certain options, if you're documenting that in the medical record and why that option, you can go so far as to say why that option is important and during that visit at that time, you're going to be fine. Um, the liability never goes away, but the medical record adequately utilized, documented, is your saving grace there.
yeah.
And this is not new. We've been doing that forever, where we had to document in the medical record because we knew we were not able to do all that we knew in our judgment needed to be done.
Yeah.
So we just don't want a person to be able to say, well, I was never told that, or you didn't explain something to me. Yeah. If we need to figure out ways to use technology to improve how we document in medical records, let's do that because and I suspect we're going to find new technological advances in how to maintain medical records on this front.
Yeah, thank you. Those are such great questions from the audience tonight. Unfortunately, that's all that we have time for.
Oh,
Thank you, Dr. Blackwell, and everyone in the audience tonight for joining us. Thank you so much, Dr. Blackwell, for all of your work and all of your insights. You're just helping make, I'm smiling because I'm just like, I have hope for our profession. It's one of these
Please keep it.
conversations that
Yes,
makes me
hold
feel
on.
that despite how it is and things getting worse, as you said, that there's got to be hope. We still have to get mad enough to keep working at it, right?
Yeah.
And so I want to thank Maddie's Fund again for sponsoring this webinar series. Before you all go tonight, let us know what you thought of this event and what more you'd like to see us discuss by taking our anonymous feedback survey, which is in the chat. Our next Beyond the Page webinar is happening in 2 weeks, really soon. We'll be chatting with veterinary technician specialist Stephen Nino Sital and Kamia Tanj about the diversifying veterinary technician specialties. You don't want to miss that one. It's going to be really good, and I'm sure we're going to learn a lot, not just about vet tech specialties, but in general. We've also got other events coming up, which you can see now on your screen. So again, October 14th for Beyond the Page. You can register for that on our website. We've got a community connections, a space for veterinary professionals to come together and connect and support one another. That's happening on October 30th. And our Rise Remix conference, our CE conference, which is a one-day virtual event. We'll be talking about all of the things: social justice, social impact, medicine. Obviously, we'll have medicine talks, and we'll be talking about well-being and addressing the needs of our profession and our colleagues and of our clients and communities. So trying to keep that conversation about diversity, equity, and inclusion continuing on in spite of all of the ways in which that conversation is under attack right now. And so please be sure to check out our events. You can also sign up for our newsletter to keep learning about our upcoming events, get more information about our conference, and you can follow us on social media. Everything about that is being placed in the chat by our lovely tech support. And that's it. That's all we have for you all tonight. I see someone. Oh, it's just a thank you in the Q&A. But thank you all who came tonight and joined us speaking with Dr. Blackwell. We hope that you enjoyed this conversation and got a lot from it and are going away with at least one or two resources tonight that can help you increase access to care for pets and families in your communities. Thank you, everyone. Have a good night.
Bye, everyone.
Take care.